Peripheral arterial dissections, or small tears in the artery wall, are very common. They occur routinely during balloon angioplasty procedures. If left untreated, dissections can cause significant problems, including acute thrombosis and occlusion, which can lead to recurrent or worsening symptoms and repeated procedures. Until now, there has been no purpose-built device specifically designed for peripheral arterial dissections. The Tack Endovascular System is designed for precision treatment of dissections following balloon angioplasty, either above or below the knee, in peripheral arteries that are diseased and narrowed with reduced blood flow to the legs or feet. The Tack Endovascular System is a first-of-its-kind implant, created to complement traditional or drug-coated balloon angioplasty procedures, and is purpose-built for precision dissection treatment and repair. During balloon angioplasty, a guide wire is advanced through an introducer sheath and across the narrowed portion of the artery. A balloon catheter is advanced over the wire under fluoroscopy. The balloon catheter is inflated to expand the narrowed portion of the artery. The balloon catheter is then fully deflated and removed. Imaging performed after angioplasty shows dissections in the treated artery, which can prevent proper blood flow. Stents are commonly used to treat dissections, but they're far from optimal. Stents introduce significantly more metal and outward force than necessary, creating the potential for vessel inflammation and reocclusion of the stent. They also cover portions of healthy vessel wall and impact natural vessel movement. The Tack implant was designed specifically to treat the precise areas where dissections occur, using less metal and lower outward force than stents. Capable of treating multiple dissections with a single catheter, the Tack Endovascular System is first advanced over the wire past all dissections. To repair a single dissection, the physician aligns the center marker of the Tack implant with the dissection, or the intended deployment site, and retracts the outer sheath to precisely deploy a Tack implant. Each Tack implant is self-expanding and conforms to fit, pressing the dissected tissue against the vessel wall. This process is repeated for each of the dissections in the treated artery. Once all dissections have been repaired, the Tack Endovascular System is removed, and a new balloon catheter is introduced and inflated to anchor the Tack implants in place. The balloon catheter is fully deflated and is then withdrawn. The Tack Endovascular System is a first-of-its-kind implant designed for precision repair of peripheral arterial dissections following balloon angioplasty, either above or below the knee. Only the Tack implant offers the advantage of focal treatment with minimal metal, reducing stress on the arterial wall and preserving future treatment options. The Tack Endovascular System is designed to help maintain vessel integrity and enhance blood flow to promote healing, improve outcomes, and preserve limbs.